Hi, I'm Georgia from Underground Fitness. This morning I'm going to go through with you some exercises that will increase the flexibility and mobility of your spine, reducing back pain, giving you a greater range of movement. None of these exercises substitute going to the doctor, so if you have severe back pain, just make sure with your doctor, physiotherapist, chiropractor, osteopath, whoever that you go and see normally to take care of your back, make sure with them that it's okay to start these exercises first. The first one we're going to do is the roll down. Depending on the spinal flexibility that you have, your feet will be away from the wall with the less mobility you've got. Mine are about 3 inches away from the wall. You're engaging the tummy, you're standing tall with the chin in. Then vertebra by vertebra, we're going to roll down the wall just as far as you can, coming back up again. Again, you're looking to try and get every single vertebra hitting the wall as you roll down and as you roll up. Each of these exercises we're going to go through with you today, you need to be doing as many times as you like. Obviously, the more you do, the greater flexibility you're going to have. Anything up to 10 rotations. Okay, the next one we're going to do is a skull rock. You're lying in neutral spine. You can feel that flat bone at the top of your bottom on the floor. You've got an arch where your curve of your back is, your rib cage is down, the chin is level, arms are relaxed. From here, we're literally going to pull the chin into the chest and release. And we're going to go neutral to imprint. So here we're in neutral spine. From here, keeping the feet relaxed on the floor, we then bring the pubic bone up towards the ribs, rolling the lumbar vertebra into the spine. Okay. Then, if we roll over onto your side, you're going to need a block or a pillow to place under your head. The feet, knees are bent, feet are in line with your bottom, shoulders are in line also, so you're still thinking about your neutral spine while you're laid on the floor. Placing the head at the front of the block, shoulders sliding down the back and the waist is pulling away from the floor, so you're still lengthening through that spine. Keeping the hips stacked one above the other, we then rotate. We breathe in to prepare. We breathe out as we open out. And then as you get to the end point, so as far as that is for you, if we take another breath in, this will increase your thoracic extension and also get you more flexibility through the front of the chest, opening out the intercostal muscles. And again, several times. The more times you do this, you'll find the further around you can get with your arm. And we remove the block from under the head, keeping the feet and the knees together this time, still in the neutral spine, the rib cage relaxed. We allow the tummy muscles to take our legs from one side to the other, just rolling on the top of the pelvis. Always keeping these tummy muscles pulled in, so you've always got that spine support. Okay? From here we're going to then go into full bridge. So where we did neutral to imprint earlier, we're going to extend that all the way up the back. So the feet need to be underneath the knees if possible. Now if you can't get your heels under your knees because of mobility of your knees, then just bring them in as close as you can. But ideally your heels want to sit below your knees. From here we're going neutral to imprint, and then keeping your feet as lightly placed as possible. Use your tummy muscles to lift the hips up towards the ceiling until you get that straight line, knees, hips and shoulders. Don't allow the legs to flare out and relax, but keep them engaged, not pressed together, but just keeping them in line with the hips that are sticking out at the front. And again, vertebra by vertebra, we roll down. And again, as many times as you want, you can do that exercise. That's called the bridge. I'm going to roll over onto my tummy now. The next one, again, is for the upper back, but also as we move further into the exercise, we get into the lower back as well. Arms want to be either directly out to the side, straight out from the shoulders, or we can have this position where your thumbs sort of would sit just underneath your forehead. From here, you're thinking about using your upper back muscles only, so toes in, heels out, this switches off your bottom muscles, keeping the shoulders sliding down the back. We then lift without engaging the legs, rolling our body up the sternum. Now you'll note that I'm not lifting my head up, it's just a movement for the upper back. And again, you would breathe out as you lift up, in as you come down. 3-4 times to get your back moving, and then we can apply a little pressure onto the hands to lift and get that movement into the lower back as well. So if you're in this position, exactly the same, and you just straighten as much as you can. Now my back absolutely hates this, just to let you know. So I have to make sure that I try and do these every day, just to try and increase that flexibility of my lumbar spine. Once you've finished that, then push yourself up, slowly and easy, gently, 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 ease your bottom down onto your heels and round yourself out into a lovely shelf stretch. Okay, so there's 7 exercises for you. I hope they've been helpful.